the American Headache Society just published an update to their guidelines for the acute treatment of migraine for adults in the emergency department. This is their first update since 2016, and it's so important. Although we may not want to, there are times when people with migraine just cannot avoid having to go to the ED. So, Dr. Smith, can you tell us the highlights of these recommendations? What's changed since 2016?
Sure. And what the authors did on this was basically a literature review of clinical trials, randomized clinical trials. And then it's sort of kind of tantamount to a meta-analysis where they look at the quality of the data and they break it out into, basically they call it level A evidence. And so it's what they say you must offer. And then they have level B, which you should offer this drug or that drug. Level C, which is you may offer. So it's like must, should, and may offer. And then they have some that they don't make a recommendation on, and then some that they recommend strongly against that you must not offer. The last time this was done is in 2016, and a new group of reviewers now. It's been almost 10 years since this was looked at. And basically, the big change in 2016, the must recommends were basically metoclopramide and prochlorperazine or Reglan or compazine, and sumatriptan, which we have been familiar with decades from now, and then dexamethasone steroids. So that was basically the must recommends in the 2016 guidelines. With this year, they reiterated the prochlorperazine, but they added this greater occipital nerve block. So they broadened their review to look at nerve block injections and the GON or greater occipital nerve block. It's the one in the occiput back here in the back of the head. The evidence was strong. They had multiple level 1 studies that showed benefit. And so they've added that to the must recommends. And so that I think a lot of us would look at that as a significant change from the previous guidelines because they never even considered nerve blocks before.